Good evening, and thank you for joining tonight's online briefing with Congresswoman Pramila Jayapal. We'll be starting momentarily. Thank you for your patience. Good evening, and thank you for joining tonight's online briefing with Congresswoman Pramila Jayapal. We're getting started now, and thank you for your patience. As a reminder, you can ask a question by commenting on the Facebook Live post or tweeting at Rep. Jayapal. If you're on Zoom, you can also ask a question using the Q&A chat feature. Without further ado, let me turn it over to Congresswoman Pramila Jayapal.
Thank you so much, Subhan, and good evening, everybody. Thank you for joining me again this evening. I know many of you have joined us on our telebriefings for this unprecedented and very challenging time for our district, our state, and our nation. I know that many of you are facing tremendous uncertainty and anxiety about the situation we're in right now, and we are trying to do everything in my office to share with you as many updates as possible on the federal, state, and local response to this COVID-19 pandemic, also on the actions underway in Congress to mitigate the harm of this virus and get relief to workers and all those dealing with the effects of this virus. I also want you to know that my district team is doing a phenomenal job, and so please reach out to them if there are individual questions. We are helping people who have family members stranded in other parts of the world. We are helping people with specific benefits that you're dealing with. We will try to do as much for you on your individual casework as we can. Tonight, I'm just so pleased to be joined again by Kirsten Wisen from Seattle and King County Public Health. We are so grateful to you, Kirsten, for the work that you are doing and that all of our public health frontline workers are doing. And I'm also incredibly excited to be joined by Dr. Paul Song, a renowned physician and progressive advocate. Before I turn it over to them for a few comments and then to your questions, let me first share the latest from Congress. As you may have seen, the Senate has approved and come to terms on a bill with the White House and with tentative input from the Speaker of the House. When I say tentative input, what I mean is we haven't seen any legislative language yet, but there is some basic agreement. We are waiting to see the language. We do not have that in front of us for a third and $2 trillion coronavirus aid package to provide relief to those that need it the most. I want to just say that the Senate Majority Leader, Mitch McConnell, had introduced a bill over the weekend that frankly was a non-starter. It did not direct aid towards workers who needed it the most. It did not have appropriate conditions on industry aid to make sure that workers were benefiting. And so on Monday, the House Democrats introduced our own stimulus package that included many of the priorities that I, on behalf of almost 100 members of the Congressional Progressive Caucus, for which I'm proud to serve as co-chair, had outlined in a letter to Speaker Pelosi last week. Since then, the Senate and House Democrats have been hard at work to try to reach agreement because we know that this is urgent and we know we have to get relief to people across the country. All of us are now reviewing the Senate agreement. I spent most of today on a number of calls with my colleagues going through what we know about the Senate proposal, but we still don't have all of the actual language. So our priority is to make sure that the package we pass includes real and immediate support for working people and families, for small businesses, and again, worker-centered relief for industries. The Senate is still finishing the legislative text, as I mentioned, and so the devil is still in the details. But let me give you a few things that are included, significantly improved from the bill introduced by Leader McConnell over the weekend, thanks to House and Senate Democrats pushing and advocates across the country pushing for some specific things to be included. First, we know that people are losing their jobs and there will be even more hurt to come in the immediate term. And so it was a big priority to enhance unemployment insurance. And the package does enhance federal unemployment insurance by $600 a week in the language that we have seen, in addition to whatever state benefits would be there. So the average laid off worker would receive 100% of their paycheck in benefit. And the bill will also waive waiting periods and extend the number of weeks that federally funded UI will be available. As you know, in Washington state, the governor is asking for a disaster proclamation so that we can expand our state unemployment benefits as well. We are still waiting for that to come through. Another thing we have been pushing for very hard is direct payments so that we can get cash in people's pockets immediately. The Progressive Caucus had called for payments of $2,000 per individual and $1,000 per child. Unfortunately, we were not able to get that amount in. We also called for it to be per month, that benefit per month for 6 months. Instead, what has been negotiated into the Senate bill is a one-time direct payment that would be $1,200 in direct assistance to every individual and $500 for every child. And that payment would be available to individuals making less than $75,000 or families making less than $150,000, or if you're a head of household or single parent, the cap would be $112,000. There is a significant package for small businesses, both grants and aid. I had several meetings with my small businesses in the district, and I heard you loud and clear. This is a crisis and we need to help you. And so the bill includes $350 billion in loan forgiveness grants to small business and to nonprofits to maintain their existing workforce and pay rent, utilities, and other expenses. So in other words, if those monies are used to preserve payroll and benefits for your employees, then you will qualify for loan forgiveness. It also includes $10 billion in small business emergency grants of up to $10,000 to provide immediate relief to small businesses. On the public health side, the bill will include $150 billion for our healthcare system. This is not just hospitals, but other providers, healthcare centers, nonprofit providers who are on the front lines of the fight against COVID-19. We were working very hard to make sure that we got OSHA emergency protection standards in. Unfortunately, those were stripped from the bill, and we do need to make sure that we are protecting the health and safety of our frontline healthcare workers, because they obviously are putting everything on the line. It also includes $15 billion to increase our national emergency stockpile. And there is a significant investment in personal protective equipment as well. But those are obviously challenges that we are still facing with testing, kits, supplies, and PPE. And it's going to take some work to really use the Defense Production Act, which unfortunately the president has not done yet, to really stimulate domestic manufacturing of these critical products and to make sure that we are getting enough to distribute across the country. The bill includes $150 billion for states, tribal governments, and local governments to pay for the unexpected costs related to COVID-19, which is absolutely essential. And on the worker-centered industry assistance, we are still reviewing these provisions. I can tell you they don't go as far as we want, except in one particular area around the airline industry. Chairman DeFazio has negotiated some very important provisions that ensure that that aid in the airline industry would go directly to paying for employee wages and benefits. And there are not all of the agreements we wanted around conditions, but it would prohibit stock buybacks and dividends for the length of any loan that's provided by the federal government plus a year. And it does impose some restrictions on any increases to executive compensation. I continue to be very worried about the almost $500 billion in a fund for that the Treasury Secretary will have control over, but I am told that there are significant oversight provisions that we were able to get in today. I'm still waiting to see that language. On housing, it includes more than $7 billion for affordable housing and homelessness assistance programs, which is absolutely critical. It does also include a 120-day moratorium on evictions for housing that is tied to some form of federal funding, which is most but not all housing. And it also includes a foreclosure moratorium and gives consumers a right to request forbearance. So we're still reviewing the bill to see exactly what made it from our much stronger House bill into the Senate bill. There are some rental assistance protections for low-income Americans. So $3 billion is included for housing providers to help more than 4.5 million low-income households made up of more than 9.6 million individuals who are currently assisted by HUD to safely remain in their homes. And there is a provision for Indian housing as well, $300 million for Native American programs. On education, the bill provides $14.25 billion for higher education emergency relief, and it does include protections for student borrowers, such as suspending the need to make payments on loans through September 30th, 2020. And during that time, interest will not accrue. Obviously, we were pushing for full loan forgiveness for this period. We were not able to get all of that in. But I will stop there because there's so much more and you can ask me about any pieces. These priorities reflect a number of the conversations that I and my staff have had with many of you across the district. It is far from a perfect package, but it is going to provide absolutely critical relief. And I have been assured that it won't be the last piece of legislation we consider. There's still a lot more that we have to pass. And so we're going to continue to work on that. And I just want to say a couple of things that I pushed very hard for that are not in this package that give me significant heartburn, and I assume will give many of you across the district heartburn as well. I really want to make sure that we're protecting immigrants and people in immigration detention facilities, as well as the criminal justice system during this pandemic. People in detention facilities are completely dependent, as are those in the criminal justice system in our jails, on the federal government for everything. And if we can't keep them safe in those facilities, we hurt public health of everybody, but we also deeply hurt them. And so this week, I led 5 colleagues in writing to the Department of Homeland Security Acting Secretary on a whole host of issues, and we will make that letter available to all of you if you have not seen it around the immigrant community. Before I turn it over to Kirsten, I just want to take a minute to talk about the strength, the resilience, and the compassion that is here in the district. I know in these times of crisis, it's easy to get frustrated, it's easy to get anxious, and of course, in this time of physical distancing, it's easy to feel isolated. But I want you to know that we are an incredibly resilient district, and I know you know this. And even as we practice physical distancing, I would just ask that we practice social closening, that we remember that we are deeply connected to our friends, our families, our loved ones, and that there are ways to continue to maintain that closeness and that connection, and that everything that you do to stay home, to follow the public health guidelines are not just about you, they are about the interconnectedness of everybody together. And we also know that there are tremendous efforts happening across the district that just make my heart sing at different moments during the day when I hear about them. The things that people are doing, like a constituent who reached out to me and said, he had 60 N95 masks in his basement that he didn't realize, and how could he immediately get them to healthcare workers? The grocery store workers who led a massive mask drive, to literally driving, building trades folks driving into homes of painters and other building trades folks to get their masks to provide them to their colleagues in the healthcare system. Ijeoma Oluwa, a Seattle-based writer and rock star friend, who set up a fund to provide emergency funding for rent, food, utilities, and medical needs to artists who have lost income due to cancellations and work stoppage. The Port of Seattle, who literally ransacked their stocks to try to get me another 4,000 masks on top of the 5,000 masks they had already delivered to Virginia Mason. They just let me know yesterday they have managed to find another 4,000 to deliver to the healthcare workers. So people are stepping up in ways that are big and small, and I think we are seeing how deeply interconnected we are. However much we get told that what we do doesn't matter, we are seeing in this public health crisis how it does matter, not only to protect ourselves and our loved ones, but to protect everybody else, and also to show what this district is made of. So I want to thank you for that, and thank the many, many public health workers, first responders, garbage collectors, grocery store workers, food suppliers, truck drivers, government employees, service providers, and all those folks who are actually still going to work to keep the rest of our systems going. So with that, let me turn it over to one of those incredibly dedicated public health workers, Kirsten Wisen, to share the latest public health guidance and give an update on testing and the governor's stay-at-home order. Kirsten?
Thank you so much, Congresswoman. It's a pleasure to talk to you. And we at Public Health also see so many wonderful acts of generosity and community resilience. Just to give you the numbers, which we update every day at kingcounty.gov/COVID, and this is for Seattle and King County's Public Health Department. In our county, we now have 1,359 positive cases, and we hit 100 deaths. I do think our region is likely, when the story is told, perhaps going to be better off than other parts of the country, in part because of the very smart and brave doctor who tested the first gentleman in Snohomish County, and we found our first positive case on January 21st. A series of health orders and recommendations and guidances and directives have come down starting even on March 3rd to recommend telecommuting and social distancing. And we do know what with the lack of testing and some serious limitations on personal protective equipment, that these kind of almost old-fashioned bread and butter public health practices will make a difference in reducing the number of positive cases, which in itself then reduces the pressure on our brave healthcare workers. The focus of the Health and Medical Area Command, and we have had 50, 100, 150 people meeting every day at 9 o'clock to 9:30 a.m. since January 23rd. And I will have to say that my emergency preparedness staff stood up a response 2 days after that first positive case in Snohomish County. And thank goodness for that, and for the talent that we do have in our public health system here in Washington State. The focus of this big apparatus of a Health and Area Medical Command is to protect our healthcare workers right now. We have we have many long-term care facilities. We've all heard of Life Care in Kirkland, but we have probably a couple dozen nursing home facilities with positive cases. That is a huge priority for the response right now, and enabling our hospitals to respond, and our ambulances, and protect all of our first responders. With that, there's kind of the scary medical part of responding to the outbreak, and then there's also the social emotional part, and there's also the economic survival. So I would recommend that everybody try to stay up to date. Information comes out honestly on a daily basis. People are working around the clock to get financial assistance information out. Mayor Jenny Durkin's website, if you live in the city of Seattle, has extensive numbers of public and private sources of support in multiple languages for multiple populations, including LGBTQ populations. Everybody's kind of kicking in and having each other's back these days. I mean, it's really some really beautiful things going on, as well as some really scary things. And our publichealthinsider.com blog post, which you can link to easily, really tries to address the social and emotional response to our anxiety and to caring about our loved ones. So just some resources to try to help you get through this very strange winter of 2020 that we're in. And I'll be happy to help answer questions at the end.
Thank you, Kirsten. Just because I know it's going to come up, could you just say a word about testing before we turn it over to Paul?
Yeah, what I know about testing, and this is kind of a situation that does change day by day, so please check back to kingcounty.gov/COVID, COVID. Testing is limited. It's really almost, it's a challenge. What I know is the priority to receive the tests really have got to be our healthcare workers and our people who work in home health agencies and with our older adults and the medically fragile. You know, some cities are standing up drive-by testing, which is fantastic. I hope that is available to a lot of people in a week or two, but this is kind of a time to maybe sacrifice a little bit. We have no immunity. There is no treatment. You need to talk to your healthcare provider, but the situation's not actually going to change whether you know the result of your test or not, as much as we all wish that we could have one. Speaking for myself as a public health person who's been part of the Health and Area Medical Command since January 29th when I joined, none of us have been tested. If you asked any of us if we wanted to be tested, we would say, please, can you go talk to the nursing home staff? Can you talk? I would rather have grocery store workers be tested than public health staff at this point. So I really hope the situation changes soon and immediately, but your doctor is your best source. And I hope the day comes soon when more of us can be tested.
Thank you. Thank you so much for that. And I would just add that, interestingly, even though we don't have the testing we need in Washington state, we have the most per capita testing of any state in the country right now, with the UW Virology Lab, thanks to their incredible getting it together so fast. They are going to be up at testing about 5,000 per day by the end of this week, which is, and delivering the results within 24 hours. So the federal sites that are coming in, just so people know, those sites will be able to be test sites, but they are saying that those results might take 5 to 7 days. So you may see, because they're not going to be sent to the UW lab, they're going to be sent to commercial labs, and it's taking longer with the commercial labs. So we are going to continue to increase testing, but thank you for that perfect message. And with that, let me turn it over to a really incredible panelist that we're so happy to have with us. Dr. Paul Song is the current president of Physicians for a National Health Program, California. He served as the co-chair of the Campaign for a Healthy California from 2017 to 2018. He is a practicing physician, and he has just been doing phenomenal work on not only on COVID-19, but also on the overall structure of our healthcare system. And later in this briefing, we hope to get to a couple of those questions about some of the larger issues. But Dr. Song, the floor is yours.
Well, thank you so much for having me. And hello, Washington. I just want to say how you should all be so proud of your Congresswoman for not only being a voice for you all, but for really all of us throughout the country who don't seem to have one in Washington, D.C. So really just grateful to her for her leadership, but also to your state, because I think you have been very proactive in the fight against COVID-19. One of the things I was following very closely was how the experts there were really trying to buck the CDC when they were told not to do tests, and they went forward and did that anyway. And I think that's really given you a little bit better handle on this than a lot of other states that didn't even have that capability to do. So there's a lot of things to be proud of in your state. Really what I wanted to say right now, in the shortest term, we do have a broken and somewhat immoral healthcare system, and we can get really into that more deeply. But in the short term, I think what we all need to do as a community is to really take the social distancing and home sheltering suggestions to heart, because we are all in this together. And we have so many people like Kirsten and her team that are in the front lines, people who've lost their jobs, people who've passed away, that have sacrificed so much. And if we don't all try to do our parts, we're just being selfish, and that's going to further exacerbate the strain on our healthcare system. So I'm sure there are some of you that are watching right now who have been working in the gig economy. Some of you have been working hourly jobs, who are really concerned about where are you going to get your health benefits coming up. Perhaps some of you have even lost your job and now have a chance of paying either a choice of paying a heavy monthly COBRA fee, or trying to figure out where you're going to get your healthcare coverage. And that's where the safety nets of states really come in, like Medicaid, and where Medicaid has been a real godsend to so many. It is also chronically underfunded, and we're starting to see how that could affect people's access to care. So first and foremost, it's very important to understand that through the congressional action, that at least to go get the test, if you do meet the criteria that Kirsten and others mentioned, that you will not have to be responsible for copays or deductibles for that. But unfortunately, the way of the healthcare system is, with regard to the treatment and ultimately hospitalization, if you became that sick, that's still something that many of us would struggle with in terms of copays, deductibles. And so I think for all those reasons, if you can avoid interacting with as many people as possible, you're going to reduce your risk and reduce your potential financial liability in getting sick. The other thing that I think is very, very important for all of us is to understand that we have this really short window of opportunity where we can start to bend this curve. And what I mean by that is, right now we're seeing the number of cases going up exponentially day after day after day. And part of this is because we're just now aggressively testing people. But also you have to realize, since that first case in January that you've had in Washington, our nation did not really take this seriously enough to start to say this could be a problem. We didn't know not much about it in terms of the public. So there's a good chance that there have been a lot of people that unknowingly infected others. There have been a lot of people that we've been exposed to people perhaps. And so during this time, the only way we can stem this until we catch up with testing, catch up with the number of ventilators, catch up with the ability to really treat these people, is to greatly minimize the spread of this disease. So that's why it's so crucial. So in the next 2 weeks, I would really encourage you, until we get some data, to really take this to heart. I know we want to interact. I know we want to have play dates for our kids and all those things, but that's really crucial. Matter of fact, today, Governor Cuomo in New York said that the first 7 days of this social distancing seems to be working, in that they're stemming, greatly reducing the hospitalizations or the time to hospitalization. So we have to keep doing our part. Now, with regard to the safety net for many of you, I really do think right now is the time, if you are really ill and really experiencing the symptoms, to find a physician or testing facility and get tested. But do not keep going back into society and potentially exposing not only your coworkers or your neighbors, but also potentially your own family members. So this is very, very crucial. Now, the last thing I just will say right now, and we'll get into it more, is unfortunately, I think this is already going to expose the shortcomings of our healthcare system and sort of the inequality that exists. Probably over the last 6 weeks or so, I am sure there's been a home caregiver, a person that is in the food service industry, a person that is doing some sort of housekeeping, that has come down with this cold, and because they didn't have healthcare, or because of the recent cruel public charge laws of this administration that really discouraged undocumented, or even people that are here illegally that are trying to eventually get their green cards from going to seek health. This has further led to an infection in our society that was perhaps unnecessary. So I do think this sadly is going to expose a lot of the shortcomings and inequality of our healthcare system. But rather than focus on that right today or as a community, I think we need to focus on doing our part to greatly minimize the risk.
Great. Thank you so much, Paul. And Subban, I think we are ready to take some questions.
Wonderful. Our first one comes from Twitter. What is Seattle doing to protect our homeless community? How are we supporting shelters and creating spaces for these individuals?
Yeah, thanks so much for the question. And listen, I have to say that it is a great privilege to live in a state that has a long history of being progressive and a movement that has really pushed in that direction. And because of that, we have state and local leaders who have taken some really important actions. Kristen mentioned Mayor Durkin. She has issued a citywide ban on rent-based evictions. Governor Inslee issued a statewide ban. And then we have stood up, I know King County Executive also has stood up a number of additional places for shelter. And that is one of the big things that they are focused on. And my job is to try to get the money to continue to be able to do that. The Senate bill will include more than $7 billion for affordable housing and homelessness assistance programs. But we still have a ways to go, to be totally honest. I introduced my Housing as a Human Right Act last week, which is specifically aimed at supporting those experiencing homelessness. And we pushed hard to get a number of those provisions into this bill. What we did not get, we will push to get into the next bill. That bill would authorize more than $200 billion over 10 years to provide emergency services as well as infrastructure to expand shelter and permanent housing. So that's very important. In this appropriations bill, there is $4 billion for homeless assistance grants through the Emergency Solutions Grant. We need a lot more than that. And there is also $200 million for FEMA Emergency Food and Shelter Grant Program that would allow our district to qualify despite normal limitations on access. So they've actually waived some of those limitations. So we will continue to push hard on this. Right now, we are fortunate to have probably a city, a county, and a state that is really taking this seriously and hopefully will continue to add to the assistance they've already set up.
Thank you. Our next question, someone tweeted, hypochlorous acid is listed on EPA's list of combating coronavirus. We must subsidize this non-toxic disinfectant to expand production and distribution to all hospitals, healthcare organizations, senior living facilities, and janitorial supplies. Dr. Song and Kirsten, can you talk about this?
Well, with regard to the subsidizing, I mean, that's not my area. I can say one thing about this. They've been using a lot of this in South Korea to really shower the healthcare workers immediately after they finish their shifts. It is it's supposedly 50 times more powerful than bleach. At the same time, far less toxic, does not irritate the eyes or breathing issues associated with it. So I do think that you see some schools that are using this to spray down their desks and things because it's quite safe for kids. And I do think we should probably start having more of it available in the United States, maybe less so for each of us in our homes, but more so for hospitals in high-risk areas that are doing this testing. It's very effective and relatively non-toxic.
A follow-up that has been posed by several different people is my mail safe to touch or my packages? What should I be doing to make sure they're safe to handle?
So I will say this, the NIH recently published something in the New England Journal that had the average lifespan of the virus on various countertops, cardboard, things of that nature. So with regard to the mail, they said for paper cardboard, it could last up to 24 hours. Having said that, I do see the mailmen and women who are delivering the mail wearing gloves. And I do think that for all of us, if you want to be extra careful, there are two things that you can do. One is you can use gloves to open your mail, or the second thing is you can open your mail, take the letter out, throw the envelope away, and then just wash your hands really, really well. That is to believe to be able to take care of that and minimize our risk. Same thing with takeout food or food that you get delivered. If you wear gloves to hold the carton that the food is delivered in, and then carefully remove the food from that. And if you ultimately have to microwave it, that will kill the virus. But if you just do those things and then try to minimize contact to the outside of the container, or if your hands touch it, again, just wash your hands before you have a chance to touch any place on your face. That will greatly reduce your risk of transmission as well.
And Dr. Song, I might add to that I saw other guidance that with packages in particular, leave them on your porch, put those gloves on, open them on the porch, and then take your cardboard boxes and things to your recycle with your gloves on, and then bring your stuff in. And then again, simple advice, but wash your hands. Happy birthday twice. I know when I first started actually washing my hands properly, I'm sorry to say, I didn't realize how long you had to wash them to be effective. And so I'm just admitting that here so nobody else feels ashamed. Saying happy birthday twice, it'll get you through your time. Kirsten, I don't know if you wanted to add anything to any of that.
No, those are great. I also think what we can't lose sight of, like, what the most positively important things are for us to do to reduce the spread, and that is for sick people to stay home. For if you suspect that you may have the symptoms, to stay home for the full 14 days. And then all our hand washing and social distancing. It's just a little bit, there's so many things coming at us these days that keeping your eyes on the highest value actions is important as well.
Great. Next question, Subban.
Sure. The next question comes from Facebook. Can you explain the desperation coming from the medical community about the dwindling supplies of ventilators, masks, and gowns? Why are these needs not being met?
Let me start, and then I'm sure both of you have something to say on this. There are a couple of things. Number one, we have, as we disinvested at the federal level in the national emergency stockpile, basically each year we kept cutting back money for that stockpile, which is the thing that allows us to immediately get supplies to people quickly. We ended up in a situation where we simply don't have enough for that stockpile for the immediate response. So that's one thing that is wrong, and we are now trying to quickly add money into it, but it didn't help us to be prepared when this pandemic hit. The second thing is that we have actually taken the supply, the manufacture and the supply of many of these things out of the United States. Many of them are coming from other countries in the world. So we don't have domestic supply of too many of these items. And then you add to that the fact that the federal government has not stepped in to show leadership on really stimulating the demand of those things in the United States. So we have a huge shortage. I know that the state recently put in an order, I think it was for, I forget how many thousands of N95 masks, and they're not going to be delivered until April. So what we need to do is have the president immediately stimulate the supply of these things domestically, as well as gather them from around the country. But then we also need coordination, and hopefully we are going to get this now from FEMA. So many of my last 2 weeks have been spent on the call with this federal agency or that federal agency, literally at 8 o'clock at night, because we get a request from King County Public Health or the governor's office or whoever it is saying, can you please call and beg for this equipment? And so that is what we have been doing at 8 o'clock at night, calling federal agencies to beg for them to release this equipment from the stockpile or to find it for us somehow. Because that has not been happening, states are competing against each other for these very limited and scarce resources. And so you're having a bidding war on ventilators, for example, when the need is so drastic. My understanding is that FEMA is now going to start leading and coordinating some of this. So they will both figure out what the supply is that we need and how to get it, and also help prioritize the demands so that they buy up all of the supplies, but then they use those private distributors to get them to the right place at the right time. It's a long and complicated answer, and it has a lot to do with disinvestment of funding and lack of leadership at the federal level to really be prepared for this or to step in and show leadership right now.
Just two actionable items right now to increase the personal protective equipment supply. The first is that the King County Office of Emergency Management has a donation portal. So if you Google King County Office of Emergency Management donations, there is a way that needs and offers can be matched up according to our highest priorities. And then the second is if you have a lead on supply of PPE, the Washington State Department of Health does have a procurement website, and it is kind of surprising sometimes who knows about potential suppliers, but these two local ways to match needs with resources are operating right now.
Great.
I really don't have much to add, except I think there's still a shortage. A lot of my colleagues are reporting reusing face shields and washing their masks. So I do think that is a real issue, although I hear supplies have been coming in more steadily. The bigger issue is the ventilators. If this healthcare tsunami really hits, the number of ventilators that we have, just from what I've heard in New York, they are over 25,000 ventilators short. I mean, think of that. And having to decide who's going to get to go on a ventilator or not is something that is a very daunting task. So that is still an area that we're woefully behind as a country.
Yeah, completely. And we talk about ventilators as if they're just medical equipment, but they are life savers. Without them, you can't live. So we're talking about life and death here. I know we have, Subhan, do you want to ask the next question?
Perfect. And this will be, I believe, our last question for this segment of the briefing. We've gotten several online about where we might be with regard to treatments or vaccines for COVID-19. Dr. Song or Kirsten, do you want to talk about this?
So a couple things. A vaccine is still at least a year away. They have begun testing it in humans right now, but you still have to wait to see if they build immunity, and that's going to take a period of time. So the idea of a vaccine really helping us in this current situation, I think, is not really possible. And Dr. Fauci actually said today that he's hopeful that we'll have a vaccine, that this will become more seasonal, but we'll be better prepared for it next year. With regard to treatments, this is an area that I think the president has somewhat muddled and given the impression that there are treatments that are available right now. They're still being tested. There are some drugs that are showing some initial promise. One is the hydrochloroquine, which the president mentioned, given in combination with Zithromax, the Z-Pak, has shown some potential, but that's very, very preliminary. And I think the fact that people are already making a run on these drugs is really unfortunate. But the one area that I would say is very helpful is using really the most scientific tools. We've been able to sequence a lot of the genomic aspects of this virus and now identified over 69 potential drugs that could work in this virus. And there are actually clinical trials going on with 22 of those drugs right now. So I really am optimistic, and all these 22 drugs are currently available in formularies in most pharmacies right now. So I do think that it's time for us to be cautious and not and still practice social distancing. But I am optimistic that sometime in the near future, we're going to find several drugs that really work in this disease, and we will have an ability to treat this. But that should not give anyone any false sense of security that you can just go out tomorrow and resume a life as normal, because we still don't have that yet. But I think hope is and help is very near. So that's the one thing I would ask you all not to get discouraged about that.
Kirsten, did you want to add anything to that? Okay, let me, let me just say something. I know we have to let Kirsten go. And so let's do that. And then we can continue with Dr. Song and me, and we'll continue to take your questions and also move to some of the bigger themes. But Kirsten, I just want to say thank you so much for everything that you are doing. And please convey our love and our gratitude to all those public health workers at King County and Seattle and King County Public Health. Know that we deeply appreciate you and your heart and your work and your commitment. Thank you so much, Kirsten.
Oh, thank you. Thank you. It's wonderful to be here with you.
Thanks so much. So let's just continue the conversation now, Paul, and say that one of the things that, we're going to go to the bigger healthcare system, but I want to pick up on this question around vaccines and drugs and all of those things. Talk to me about immunity. Once you get this, what do we know about whether you can get it again? And also, I have been struck by how much we are learning about the disease and the virus. In the beginning, it was that you couldn't spread it if you weren't symptomatic, but now we are seeing 70 to 80% of transmission is asymptomatic, which is even more important for people to stay home. We're also, originally we heard that, hospitalizations wouldn't occur unless you were over 60. Now we're hearing, no, actually hospitalizations under 50 are quite substantial. Can you talk about those things and what is happening? How do we make sense of them? And what should people take away from those different new pieces of research?
So a couple things. One is that this is a very fluid situation. We're seeing more and more data come in by the day in terms of who responds to treatment, what were sort of the characteristics of people that succumb to the disease. So I think that there's still a lot of things that we don't know, but based on all of the infections that we've seen and reported cases, as you mentioned, roughly 80% of people that get infected are infected by somebody who didn't exhibit any symptoms. And that's what's so scary about this. And that's why for those of you who think you might have it or don't have a symptom yet, that if you have like my mom is 88 years old, that I better be very careful if I'm going to go spend time with her because of the potential risk of unknowingly spreading this virus. Second thing is that with regard to infections, from what we know, again, of all people who get infected, only 20% require real aggressive care, and roughly about 12 to 15% ultimately need to be put on a ventilator. But when you look at the sheer population of the United States being 350 million people, if you take, let's say, some people have said 10% of the population, or maybe up to 50% will be infected, and of that 10% will require a ventilation. We just don't, we don't have that many ventilators, and that's another potential risk. The question of reinfection. So as we all get infected, whether it be to chickenpox or some other illness, we usually, once we survive, our bodies produce antibodies so that if we are exposed to that virus again, we can attack it before it ever becomes a symptomatic problem. What so far people are not sure of is what is the reinfection rate with coronavirus, because it hasn't been around long enough. There are some people that think the likelihood of being reinfected is very small, and yet we hear a few examples of people who have gotten reinfected with this. As we follow patients longer, we'll have a better idea that we don't know if it's something where you had the infection all along and just you never fully recovered, and then as you got worn out, it reactivated, or was it indeed another exposure, another infection? Those are the things that I think are still waiting to be played out. Some good news that I saw today, though, is that viruses are very tricky, and as they kind of spread around, what they're known to do is constantly mutate. So they may be sensitive to one therapy today, and then like 3 months from now or a year, they grow resistant to a treatment because they have now mutated. From what the scientific experts and research that I've seen as of this morning is that when they have been sequencing the virus in various patients and looking at the differences in the genomic sequencing today than when we first saw reports in China, there's been very little mutation so far, which is great, which is something, again, that's of encouragement. But as they say, a lot of things are still being borne out. Now, some people might have heard that the cruise ship in Japan, some people recently found evidence of RNA on surfaces there that were 1 month out. But that doesn't necessarily mean that people could get infected from something that had been sitting around for those surfaces. These are all things that are constantly being reported, evolving. All of the experts are taking this information and trying to really give the best answers. So I would ask all of your constituents just to stay informed. At the same time, don't go buying these fake remedies for the coronavirus. Right now, there is no really proven accepted treatment for this, but I do think there will be very shortly.
Great, thank you. And we got a lot of questions from Facebook that were around that set of issues. We're also, I'm going to move to some bigger issues I want to ask you about, but I noticed that we're getting a lot of questions on the gig economy, specifically to me around what Congress is doing on gig economy workers, and we're still reviewing the language. We do believe that that the gig economy workers, independent contractors will be covered through the federal unemployment insurance benefits, but I don't want to be too specific about it because we are still looking at the language, to be totally frank. And we want to make sure that I don't give you information that's not accurate. So we believe that they are setting up a separate system that would expand the unemployment insurance program to cover those gig economy workers, domestic workers, and others like that. Okay, so now I want to ask you, I mean, you and I have worked together on trying to pass Medicare for All and universal health care. And I just want to ask you about this question about universal health care as it applies to the situation. Some people, to me, it seems like this really clearly articulates why we need universal health care, so that you would have more quick, centralized response in a situation like this, where the healthcare system could immediately respond to people, get people tested without having to negotiate with insurance companies. Also would be able to negotiate prices on, drugs and things like that. But also I was thinking about the system itself and wondering if you can speak to the additional challenges that we have in the United States, because we have a population that has delayed healthcare for so long that we have a lot of people who may have underlying conditions, may not even know about it, may be sicker. Can you speak to that and also answer this question that many people are asking about how we can talk about universal healthcare and the benefits of it when Italy has a universal healthcare system, but obviously is struggling. And I'm glad to see that Italy also appears to be finally having a decreasing number of cases. But speak to that a little bit, the larger question of healthcare in our country.
Sure. So I think you saw the Vice President Biden use the Italy situation to sort of say that a single payer system doesn't work. And I thought that was very disingenuous. So let's talk about first two single payer systems and how they've had very different outcomes. One is Korea, and the second one is Italy, that has a form of universal healthcare for their country. The difference in both of them was how seriously they took this disease from the beginning. Whether or not you have a single payer system or you have a current fragmented system that we have that's very for-profit, if you overwhelm the system with 10 times the more people that need ventilators than actually have ventilators, neither system is going to work. But as far as how a single payer system could prevent the number of people that need ventilators, what we're seeing here in the United States is we're actually seeing a lot of patients who are not over 65 who are being hospitalized. Louisiana just mentioned that they're seeing a lot of people primarily in their 40s who are requiring hospitalization. And what is it about Louisiana? They have some of the worst health outcomes. They have the highest maternal mortality. They have a high amount of obesity, diabetes, chronic respiratory syndromes. And those are people in a state that up until recently had not expanded Medicaid. So these are people that were left untreated constantly. Their health conditions became worse. So they are much more susceptible to something like the coronavirus. And that's where I think you'll start to see how a chronically under cared for population will really expose the problem. So if we had a single payer system, and why Korea was successful is they did a combination of very aggressive testing. They learned from prior experience with the MERS virus. And then also anyone who got sick was able to get care because of their single payer healthcare system without any cost, no out of pocket, no copays, no deductibles. So they immediately sought care. Whereas people here, probably in the last 4 or 6 weeks prior to your congressional action, who had symptoms were delaying seeking care because they just couldn't afford the copay or the deductible. So I do think that when Vice President Biden said that, that was very, very dishonest. Let's look at our healthcare system. I hope and pray that this tsunami doesn't hit, but you already see, like in areas like Los Angeles, where people who have means and can pay out of pocket, the LA Times did a story about how they were able to find a doctor and go pay for testing, kind of like getting a genetic test that they wanted to do or an elective full body scan. We shouldn't live in a system where if you have means, you can go get the testing or the coverage, whereas those that don't have means cannot. And what a single payer system would do is it would really very much level the healthcare system, and it would provide everyone with the proactive care, the checkups, the being able to afford their diabetes medicines, being able to afford all of the necessary supportive care to get healthy, so that when the next infectious threat comes around, we as a society are healthier, and as a result, perhaps maybe our overall cost to society will be far less than what we will probably see right now.
So related to that, a constituent wrote on Facebook, this is the question: I'm still paying my premiums for healthcare, and I will be for months, and I'm unable to get any regular healthcare for several months because of this. They are slowing a curve that will last for months, and then everyone will be trying to get in to their to get their medical care. What are we going to do about that? How are we making people in our medical system whole for that? And how much is our healthcare going to skyrocket because Trump has created a bidding war for supplies? What are your thoughts on that?
Well, good question. Today, what we had was there was an actually story about a rocket engineer whose breast cancer surgery has been delayed because of the situation. And so I would imagine that your constituent who wrote this has some, quote, non-emergent health condition that is requiring seeing a doctor, but they've delayed either elective surgeries or things of that nature. So he or she may be paying these premiums and not able to access the healthcare system that they need right now. This is sort of the sad reality that, one, we're paying so much of our monthly paycheck towards premiums, and now we can't even access our healthcare system when we need it. I do think that that is something that hopefully you all can take up in Congress. Covered California, which is the state-run exchange here in California, they just published a study yesterday that showed that they think that the insurers are going to jack up all of our premiums because of the future potential risk of paying for additional coronavirus cases, and that premium increase could be over $2.5 billion nationwide, roughly 10% per person. And as you know, the Affordable Care Act didn't have any insurance rate regulation built into it. How do we get through this is by eliminating the for-profit immoral healthcare system that we have. And that's why I really am grateful for your leadership on trying to make that happen.
Thank you, Paul. I mean, this is something that I feel so strongly about because, you know, unless you both cover everyone and you address costs, which no other system that is out there that's being proposed does, you cannot get universal healthcare for everybody. You just can't do it. And so that's why we're going to keep pushing for that. And I think the situation shows it better than anything else. I know there are a lot of people that asked again about testing capacity and availability. So let me just, in case people missed this, let me just say this. We, in Washington State, we are really grateful to the UW Virology Lab for getting up and running so quickly. We are testing. We have the highest per capita testing of any state in the country. That's not That's not enough. I'm not trying to brag about this, but we are up to at least 5,000 tests per day that we're able to process in less than 24 hours. One of my colleagues, actually from California, is trying to wait for her results for a test because she has some symptoms, and she says she's being told she's got to wait potentially up to 10 days. And so, we are trying to do the best we can in Washington State. We are going to get some additional federal capacity in for testing, but the reality is, as Kirsten said, please just know that unfortunately we're triaging right now. And so just please stay home, talk to your doctor. If you're really sick, of course, if you have the symptoms, call your doctor and see what your doctor recommends. You do have the capacity in the state to get a test if you are in that situation, but we are trying to reserve the vast majority of our tests for those frontline workers, for those healthcare workers and other folks that are on the front lines. So I know it's frustrating. We will continue to work on this, and we'll continue to give updates to people. But if you stay home and you really are careful, and I posted a personal Facebook page over the weekend because I was hearing reports of constituents. It's beautiful in Seattle, which you're used to in California, Paul, but we don't always have that weather here. And so people were crowding the beaches. And so we just need to make sure that we continue to do that. So let me just say, I think we're just about at the end of our time. And, there are lots of questions that are just asking if I think the Senate bill does enough for working Americans and if there's enough guardrails on corporate stimulus and will there be help. What I will just tell you is we don't know all the language yet. We have an agreement and we have an outline, but we do have significant protections in this. And I think that at the end of the day, we will have to look and see if we think that in the vast majority of ways that we are going to get this relief to people, that is going to be most important. And then we're going to have to fix some things, I think, after that. So we're still waiting. We're still trying to get the strongest guardrails that we can. And we are trying to get immediate assistance to people that need it the most. So I will continue to look at this. And I want to just say thank you so much to you, Paul, for everything that you're doing and for joining us on the call. We so appreciate it. And we know that California is hard hit as well. And so we wish you and your family the very best, and your community the very best in California. And to everybody that joined us tonight, thank you for the tremendous privilege of serving you in the U.S. House of Representatives as your representative. But most of all, thank you for being a deeply compassionate, loving, caring, committed community that is going to take care of each other, because you know that we're all better off when we're all better off. Thanks so much. Be kind to yourselves, be safe, practice good public health guidance, and we'll see you next time. Have a good evening.
Thank you for joining tonight's online briefing with Congresswoman Pramila Jayapal. We'll be following up with a newsletter that includes a transcript of tonight's briefing, and we'll be going through comments and answering as many questions as we can. As always, you can sign up for Congresswoman Jayapal's newsletter by going to jayapal.house.gov/newsletter. Thank you and good night.